Did you know that male infertility has been increasing over the last several decades? And before you go and catch your ticket to fly somewhere, you should know that this is, in fact, a global issue. Hey, you guys, thank you for joining us again. Wait till you find out just how much dad genes actually affect not just infant health, but also maternal health. Thank you for joining us. Click subscribe. That's correct. Male infertility has been increasing for the last several decades, and it is not a US problem, but in fact, a global issue that's been getting much more attention, and it should. It is thought that male infertility has been increasing due to several factors. The rising in what some would consider to be a pandemic of obesity, delayed parenthood, and exposure to environmental toxins. Today, we're going to talk about these categories and shed some more light on exactly what's been going on and why you should be paying attention to not just female infertility, but male infertility as well. So, oftentimes, when you think of female infertility, we think of age as being one of the primary factors, and that is correct. It is very well documented that women who are over the age of 35 at the time of giving birth are more likely to have certain types of complications. But we haven't paid as much attention to the male partner's age. And given the rising studies and information that we're seeing in this particular area, we should. So, one of the things that is different when it comes to male and female infertility with regards to an aging population or a delayed parenting population is the fact that whereas with female fertility, we have pretty much a consensus on where advanced maternal age starts, age 35. Whereas with male infertility and advancing age, there hasn't been quite a consensus, according to the American College of Obstetricians and Gynecologists. However, according to the American Genetic Association, the age that is considered to be the threshold for advanced paternal age is at age 40. Though a lot of studies, in fact, have started to look at the advanced paternal age starting from age 35 in terms of the hard stop or where we are beginning to counsel patient, most people will use age 40 as the cutoff. But it's very important to know that the studies linking certain outcomes, some have included the 35-year-old father and older, or 35-year-old partner and older. And some of these outcomes show a varied level of severity or prevalence based on how much the male partner or male factor is. So, what you should know is that paternal advanced age has been linked to increased risk for new gene mutations. And although the specifics with regards to these mutations are not quite clear, it is clear, however, that with increasing paternal age, there is an increase in likelihood of new genetic mutations. And a matter of fact, I think one study showed that there is a new genetic mutation or two new genetic mutations every year of advanced age of the male partner. Interestingly, also, the advanced age of the male partner has also been linked to the outcomes in mom's maternal health. So there are studies that are showing increased outcomes such as miscarriages, hypertensive disorders, likelihood of gestational diabetes based on the male partner being of advanced age. It's also been shown that an increasing paternal age has been linked with affecting the volume of sperm as well as the motility of sperm. When it comes to neonatal outcomes, advanced paternal age has been linked with several outcomes such as low birth weight, the likelihood of neonatal seizures, the likelihood of admission to the NICU, and also the use of ventilation at birth, as well as preterm birth. So there are several outcomes in terms of the newborns outcomes that have been linked directly to advanced paternal age as well. Now, one category that may be a little surprising to you is that advanced paternal age has also been linked to developmental issues as well as psychological or psychiatric illnesses. One interesting outcome that's getting lots of attention is the fact that advanced paternal age has been linked to schizophrenia. In fact, one cohort study showed an increase of 89% increase with every 10 years of advanced paternal age. That's pretty significant, you guys. Now, one thing some people may say, well, advanced paternal age, delayed in parenthood, has also resulted in an increase or rise in infertility, the use of artificial reproductive technology to result in having offsprings or children. And that is true. The rise in infertility amongst men and women have also resulted in increasing use of ART or REI services. A lot of people look at infertility medicine as if it's a solution or a fix or some type of substitute for earlier childbearing years, but it's not. Even though it is a great help for many couples and many single parents looking to have a child, it is not the equivalent of having children at an earlier age and doesn't pretend to be that solution, in fact. So it's very important to know that the outcome of using REI services is affected by the age of the mom as well as the age of the dad, or the age of the woman as well as the age of the man. So here are some outcomes that you may want to know when it comes to the use of ART in advanced paternal age. So advanced paternal age has been linked with certain outcomes when it comes to the use of ART. That's important for you to know. Again, it's not a replacement for earlier parenting. It is a solution for those who decide to delay parenting, but it's important that you know the full picture. Advanced paternal age with respect to ART has shown poor embryo quality, so increased rates of poor embryo quality, increased rates of miscarriages, decreased rates of fertilization, decreased rates of implantation, decreased rates of pregnancies, decreased rates of the result of a live birth, and increased rates of miscarriages. So it's really important that we are aware of these outcomes. So, one more interesting outcome when it comes to advanced paternal age is that there was a Denmark study that also showed increased rates of hematological cancers such as leukemia. There have been other studies that have linked advanced paternal age to CNS tumors or central nervous system tumors, as well as breast cancer. So keep that in mind also. So the other factor we talked about was obesity. And again, when it comes to obesity and a lot of these outcomes, we're talking about epigenetics. And to give some clarification on what is this major term called epigenetics, what does it mean? Well, we all know that there are genes that are passed on from mom and genes that are passed on from dad. Well, there's also epigenetic factors, and these are molecules that have the ability to augment the expression of genes. And so these epigenetic factors, which are can be influenced by environmental factors, can lead to certain genes being silenced and can also lead to certain genes being turned on or expressed. And so what a lot of these studies are showing is that epigenetics has a role when it comes to male fertility, that then ultimately affects the sperm quality, sperm motility, the normal morphology of sperm. And there's lots of research being done in this particular area. So let's take a look at the second category. We talked about obesity. This is the one that you're really going to want to pay attention to because it has so many potential outcomes. So, as I mentioned, there is a worldwide global pandemic when it comes to obesity. Not only does dad's health and lifestyle affect the proximal offspring, but it also can potentially affect two generations or multiple generations from that male partner. One of the things that we are focusing more on and a lot of studies are being done on male infertility with a focus on obesity and being overweight. And we know that the primary outcome of the primary outcome of male obesity is really a low level of testosterone. So we're talking about a hypotestosteronemia state. And this is not just with individuals that are classified as being obese. And yes, there is some limitations to the use of the BMI. We can't just look at the BMI because there are some individuals who will have high BMI but have a very high muscle or lean muscle percent, or low body fat percentage. And so we're not talking about the healthy group with the high BMI. We're talking about those who have sedentary lifestyle, who have a high body fat percentage, who are not very active and who have unhealthy eating habits, right? So that is the category of male partners that we're looking at. Another important takeaway is the fact that this is on a spectrum, right? So we're not saying that those who are classified as obese are the only ones that have some outcomes that show the effect of their unhealthy lifestyle on their offspring. This can also affect those who are categorized as being overweight as well. When it comes to the potential or the degree of the impact, it's significantly higher the higher the unhealthy weight, or the higher or the more unhealthy lifestyle that male partner or that male father has. And so that's important to be a takeaway. It's not just those who are categorized as being obese, but also even those who are overweight. One example of this was a study that was done by assistant professor in nutrition and epidemiology at Harvard School of Public Health. So this group of researchers did a combined studies that included 14 studies comparing sperm count in obese, overweight, and normal weight men, along with studies from from an infertility center. And what they found was that overweight men were 11% more likely to have a low sperm count and 39% more likely to have no sperm in their ejaculate, whereas obese men were 42% more likely to have a low sperm count than their normal weight counterparts, and 81% more likely to produce no sperm. This shows you the sort of increased factor. The higher the weight, the higher the likelihood of having some type of negative impact on the sperm quality. We know that obesity directly affects sperm function. It impairs the reproductive potential of male offsprings. We have also made it very clear that this is multi-generational, and it's also important to know that these findings don't just impact the male offspring, but the female offspring as well. So this is not just a male to male impact. This is a male to offspring, male and female. And there was one particular study that looked at obese dads who had unhealthy habits or unhealthy health habits. Their findings showed that there was an increase in their daughters of having a diabetes like disease. And so that's important to know also, that there is a link not just with the male offspring, but also with the female offsprings as well. So, just to kind of summarize the impact of that, we know that male obesity leads to infertility. We know that it leads to a decrease in sperm concentration and motility. It increases sperm DNA damage. It affects male obesity, also affects just overall sexual function, with a higher rate of sexual dysfunction, higher rate of endocrinopathy, so having in general hormonal issues. We see impact on the psychological health and the thermal effect of the male partner. We know that the internal temperatures are important for healthy sperm. We see that the impact on sleep apnea. We're going to talk about sleep in a second, and we also see the impact on even just the inflammatory changes and obstructive elements in the epididymis pathology as well. There's structural impact, not just biochemical impact when it comes to male. Uh, when it comes to male obesity as well. So that's important to know. So we also know that obese fathers are more likely to have children who have hypomethylation of a region of their insulin type growth factor. So what does this all lead to? And basically these children or offsprings that have these hypomethylation There are some studies showing that there are some cancers that are more common in the offspring. That includes colorectal cancer, ovarian cancer, Wilms Wilms tumor, which is a renal or kidney cancer that's common in the childhood years. So it's really important to know that there's also some link with male obesity and certain types of cancers in their offspring. There are studies that have shown that male obesity affects their offspring in terms of glucose metabolism impairment, hepatic function, in terms of kidney function, in terms of just even feeding behavior is affected. We know that male obesity leads to or has been highly linked, just if not slightly more than maternal obesity, to childhood obesity. And we know that childhood obesity then leads to adulthood obesity and cardiovascular disease as well. There is some direct link between studies that are looking at male obesity and the level of cortisol in the umbilical vessels and how that affects then childhood metabolism and obesity. So there's lots of great studies being done in this particular area. It's important that you know that the takeaway is as much as we focus on the maternal dieting and the maternal pre-pregnancy weight and maternal weight gain, it's also equally important to look at dad's weight and dad's lifestyle in terms of the outcome of not just the children, but even the maternal health as well. It's important that we look at dad's lifestyle and dad's weight of body fat percentage, if you prefer, in terms of the likelihood that his unhealthy or healthy lifestyle may, in fact, impact his offspring multi generationally. So let's now talk about environmental factors. So there are a number of endocrine disruptors that have been linked to male infertility. And there is such a vast list, but some of them you've already heard about because they're commonly talked about. And so we're just going to touch on those slightly. So we know that BPA, you're looking at those containers when you buy those plastic containers. We know that BPA. Hey, you guys, you should also know that PCBs and PFAS substances have been also shown to affect sperm motility. So, again, being aware of a lot of these endocrine disruptors that are in our hygiene products, our cleaning products, our household items, name it. And so, just reading those labels and making sure that we minimize exposure to these unhealthy endocrine disruptors or environmental factors, chemicals that we are surrounded by from day to day. It's important when we talk about not just mom's health, but also dad's exposure as well. And then there are toxic habits. So we know that certain toxic habits are very obvious because they've been talked about so much, but let's review a few of them just as a refresher, because I know you guys know this, right? We know that cigarette smoking has been linked to male infertility. We know this. We know that cigarette smoking is not good on multiple levels. Just add male fertility to that list. We also know that that illicit drugs. We know that cocaine. We know that heroin or opioids. We know that methamphetamines have been linked to adverse outcomes when it comes to male fertility. But one thing you may not be aware of because it's been legalized is cannabis. So also keep in mind that cannabis negatively affects a guy's fertility. So if you're trying to get pregnant, you may want to stop smoking for some time until we have a healthy outcome. In addition to that, secondhand smoking affects the child's outcome or the neonatal outcome as well. So even in states where it's legalized, when it comes to fertility, cannabis is a no-no. Sorry, y'all. Don't shoot the messenger. That being said, also let's look at something that's also very commonly used, alcohol. So we know that mild use of alcohol has not been clearly linked to male infertility, but we definitely know that moderate and high use of alcohol has been linked to male infertility. So again, you want to reduce these behaviors or eliminate these behaviors, preferably if you are trying to have a child. So, one area that's not quite as clear, we know that caffeine has a negative impact if mom is consuming the caffeine, but it's not as quite clear if caffeine has the same type of impact when it comes to male fertility. So, that one, put a pin in it. We'll get back to you when we have more information on that. Okay, so one area that we know we're going to get into, we're going to step on a few toes with this one, specifically the cellular device smartphone toes. There have been growing studies that are showing a possible link between the use of cell phones and male fertility. I know I said it. I know I said it. I didn't mean to hit y'all in the pocket, but we need to take them cell phones out the pocket because there is some concern about the radio frequency electromagnetic waves, um, and in animal studies and early human studies that are showing that there may be a negative impact of the use of these cell phones when it comes to male fertility. So you want to at least not put it in the pocket. Don't carry your cell phone in your pocket. Keep your phone at a distance if you can. Um, do things to minimize your exposure. So use your phone when you have good reception, because we know low reception increases the release of those radio frequency electromagnetic rays. So you want to do things that minimize your exposure to these radio frequency magnetic waves. And the most important one that we probably all can do is just not putting the cell phone in the pockets. That's a simple way of reducing your risk. Two more items that are not in the major categories that we just reviewed, but very important and require some honorable mention. So one is sleep. Sleep, we know. You guys, we've talked about this ad nauseum, right? So sleep impacts your health. There's just no way around it. An adequate amount of sleep is recommended for a number of things. Sleep is a great anti-inflammatory, but if you don't get enough of it, it results in some pro-inflammatory changes in the body. And one of the things that impaired sleep or insufficient sleep has been linked to is male fertility. I know it's kind of a surprise, a shocker. Well, not really, because we've already talked about the impact of sleep on health. So it kind of does make sense, right? So, you guys, just to clarify a little bit here, so sleep has been linked to lower testosterone levels, and we know that testosterone is really important for healthy sperm and for good sexual function. It has also been linked to decreased semen parameters. So the quality of sperm is also affected by improper sleep or impaired sleeping. So if you are a male partner and you are trying to have a child, a biological child, it's important that you get at least 79 hours of sleep during the time frame in which you are attempted to have a child. The other honorable mention when it comes to male fertility is stress. So we are starting to see a lot of studies come out when it comes to fetal programming. And we talked about fetal programming when it comes to mom's health, mom's mental health. We talked about maternal stress when it comes to pregnancy planning and her fertility. We talked about stress when it comes to maternal health and the impact biochemically and psychologically on her offspring. And we are also talking about the impact of maternal stress in the postpartum period, her ability to bond with her child, and those early years of relationship programming when it comes to her offspring. But we haven't really talked much about paternal stress when it comes to the offspring. And it's important to know that there are early studies, now these are animal studies, that are showing there is a negative impact on the outcome of the offspring when the dad is under a stressful situation. And so if dad is experiencing stress, early animal studies are showing that the offspring have an impaired response to stress. Again, let me repeat that. Early animal studies are showing that if dad is experiencing undue stress, then it's very likely that his offspring is going to also have an altered responds to stress. So the inability to deal with stress. And we know that we're seeing that almost in an epidemic manner when it comes to the younger generations, that there seems to be some impairment with the ability to deal with stress. That may be a factor in these increased levels of suicide that we're seeing in the adolescent, the young adult population. So it's important when we're looking at these outcomes that we don't just look at what's going on in this time frame, but we look at what the the but we look at what the father or the parents exposure to stress and the parents mental health was, in order to have some insight on what's going on in the current offsprings. So if we can think of even minoritized groups, I got to take it and make it relevant to us. Just give me a minute. So if we take this information, we look at the experience of minoritized groups in America, and we take into consideration that minoritized groups are more likely to undergo undue chronic stress. And we talk about this a lot when it comes to Black maternal health outcomes. But now take and extrapolate this information. If these early animal studies are true, then there may be something to be said for how the offsprings of perhaps even Black dads respond to undue stress. That can explain a whole lot. We can do a whole session just on that topic right there. Okay. But I say all of that to say, let's summarize what we've learned today. Perhaps we need to restructure how we look at the preconception counseling. And traditionally, preconception counseling has been focused heavily on the mom. But we know that when it comes to the outcomes of fertility, that the male factor contributes or explains up to 40 to 50% of infertility in couples. So we have already known historically that male factor is just as much a contributor to infertility in a couple as the female factor. So again, perhaps we need to have men going for preconception counseling with their clinicians. Or perhaps we need to now do combined preconception counseling and allow for insurance companies perhaps to reimburse for the counseling of couples and not just the individual, unless it's just the individual who's planning to parent. You got me with that? It means nothing if we have all this information and we do nothing about it. So it's really important that we pay attention to these outcomes and inform partners or potential fathers that their health is just as important when it comes to the outcome of their children as the health of their female partner or the female origin of the eggs, because there are diversity of couples. So it's important that we take all these things into consideration. So that being said, just to recap a few things we said, major factors when it comes to male outcomes in terms of their offspring is the obesity factor, environmental factor, as well as the age of the dad. And honorable mention, sleep, as well as stress levels. So the psychological health of the dad is equally important as that of the mom. So we need to keep all these things in mind. And when we counsel couples and we counsel in the office, that we are not just counseling specifically to the female, but also talking about her partner, the health of her partner. And for moms and aspiring moms out there, when you go into the office for your preconception counseling, because I know you all, because we talked about the importance of planned pregnancy and improving outcomes, that you also are familiar or start to have dialogue with your partners about their each other's health and what about your health can potentially affect your offspring. So we're going to change how we are looking at paternal health and maternal health so that we are able to have better outcomes in the offspring. And we're going to balance this conversation a little bit more than we have been previously. That being said, I hope this information was helpful to you. And I hope that we are now starting to a trend where we rethink paternal health and the health of the offsprings by looking at the health of dad and encouraging dad to live a healthier lifestyle. That being said, this is Dr. T, the hand behind the handle of Healthy Bump Club right here on you, and the hand behind the handle of Healthy Bump. Club on Instagram. I thank you guys for watching, and don't forget, check out some of our other videos because we also did a video that's fertility based on his nutrition. Make sure you catch that episode with our nutritionist. We thank you guys for watching, and we hope to see you in next episode. And